And good afternoon. I'm Dr. Deuk. Our patient is here because she has a problem with the L5-S1 disc. She has a high iliac crest. We're going to go in and try to fix that disc. Shot? Shot? To do that, we're going to use a needle first to get into the 5-1 disc, and then, shot, we're going to repair it. And the way we repair the disc is with a laser. We do it endoscopically. She's from all the way from Florida, West Palm. And one thing I discovered when I met her in clinic was that she has pain like so many people coming from more than one place. Are you awake? Shot? Shot? Yeah, all right. AP? She has pain not just from the L5-S1 disc. Perfect. She also has pain from her SI joints, her piriformis muscles on both sides. And I believe she has facet pain, yeah. 4551 on both sides. So we're just fixing the disc. We will get to the rest of it later. Shot? Is she awake?
How are you? You okay?
Shot?
Don't move, okay? You're doing fine.
Shot?
I'm going to ask you some questions.
All right. I think you're off on orbit a little bit. Yeah. I know. Is that where you feel? Is that where you get your pain?
You're feeling that in your back or your legs?
Her back. Give me a discogram material. Is that better? Shot? How bad is that on a scale of 1 to 10? Shot?
What's the number? What number? 10? Yes.
All right. Is that where you get your pain? All right. So we're going to put her to sleep. Let's get an AP. You can see some of the dye within the disc. Her disc is extremely collapsed. Yeah. That's what I was worried about. It's so collapsed and scarred, it's pushing me laterally. Let's go back to a lateral view. I want to try to get, if I can, into the disc a little bit better than I am. You can put her to sleep. All right, let's see what we've got here. That's, what do you think, Jordan? A little better? No, I think we're good. I'm going to put the guide wire down. Num skin. Oh, you do? All right. So basically, we're going to fix one of her many causes of pain, and that is the L5-S1 disc. It's severely degenerated. Most people would say, how are you going to fix a degenerated disc? Well, we don't actually make it look normal. We're going to we're going to essentially clean out the tear in the back of the disc where the pain is coming from. That's how you get rid of the pain from a disc. And we call that procedure a debridement. And the surgery itself is called the Deuk laser disc repair. You see how there's a double shadow on the facet, the superior facet? Is there any way we can get that lined up a little bit better? I think we're off on orbit. Huh? Shot? All right, num. So we're going to give her a little more numbing medicine through the dilator. dilator has a cannula built in. It allows us to inject numbing medicine. You just have to be careful. You don't want to inject too much by the nerve, because then you put the nerve asleep and the patient is going to have a numb leg after surgery. You don't really want that. Any questions, Henry?
At this moment, no current questions.
All right, so I'm trying to get in just underneath the nerve. And because of her iliac crest being so high, it's really forcing me. I'm trying to, hold on. I'm trying to pull my dilator north and angle it further south. It's really hard. Shot? All right. Give me an AP. Shot. All right. So her anatomy is such that it's really forcing me into a bad angle, but I think we're still able to get it done. Shot. She's not liking me. She okay? Yeah, this is a very painful disc for her. All right, Henry, while we're waiting, let's roll the video on how is it that these disc injuries cause so much back pain. Okay, welcome back. Are we ready? All right, so she was putting her a little bit deeper, and I'm really angling as far as I can medial. But looks good on the lateral view. We just got to get over medially on her. Shot? All right.
Good.
Yeah, I think we're okay. Let me see. Yeah. Not easy to get into that disc. Shot. We're using a, go ahead. We're using a series of dilations. We use first the needle, then the guide wire, then the dilator, and then the tube. Now, this concept of progressive dilation is not new to us. It's been around for a while, and a lot of the older systems were much bigger, bulkier, and they had bigger dilators, more dilators, sometimes 5, 6, 7 sequential dilators. Look at the angle. I'm having to operate up by her shoulder because the angle is so steep because her iliac crest is so high. All right. So, a lot of inflammation. That's the painful part of her disc, folks. I apologize, the view is not great. Lasers on. But we are inside the L5-S1 disc. And specifically, we're inside the herniation. We're inside the disc. And look at all this scar tissue here. It's unbelievable. So this disc injury has been around for a long time, several years, at least probably around 20 years. You can see how scarred the herniation is. It's just thick. And as I said earlier, when I examined her, when I did my Zoom call with her, her pain was primarily at the L5-S1 disc. So we decided we're going to fix that disc. But then when she came in for an exam, she had not just L5-S1 pain, but she had facet pain, she had SI joint pain, she had piriformis pain, and so she has all these other causes of back pain besides the disc. Okay? So I told her she's going to have to get those fixed too. And she just wanted to get this fixed first. Any questions? Here's a piece of herniation. Very tough. Fibrous.
No current questions, but we do have a comment and or seeking advice from Augie on YouTube.
Hello, Augie.
Asking, 1 month ago, I had a microdiscectomy at L5 and S1, and it didn't get fully better.
Yeah, I would love to know, Augie, what are your problems? Like, what is it that's bothering you? Back pain, leg pain, numbness, tingling, weakness, all of the above? Really, the best thing to do, Augie, would be to get a new MRI and send it to us to look at Deuk Spine. I'll personally review it with you, and I'll be able to tell you what's wrong. So I do that, I don't look at the MRI to tell you what's wrong, I look at you. But I need the MRI so I can also see what's happening inside. But what I tell everybody is, MRI will never tell you where pain is coming from. The patient does. The patient is the most reliable test for where pain comes from. No, don't do that. Don't do that. Because I heard that noise and I thought something was going on with the laser. You know what I mean?
Yeah.
I thought maybe the fiber snapped and it was... All right, any other questions?
No current questions. We do have a comment from Augie once more on YouTube saying, I'll do it.
Yeah, do it because it's free. And because you'll get answers to your questions, like what's wrong. I'll be able to tell you what's wrong. And you don't have to come here and get treatment. You can if you want to, but at least you'll have answers. You'll know what's wrong and what needs to be done to fix it. And that's important for peace of mind. You know? I'm certain I can fix your problem. I just don't know what exactly needs to be fixed. So doing the Zoom call with me will allow me to understand what's wrong with you and then to advise you on the best way to fix it. By the way, not everybody that we meet with gets a recommendation for laser surgery because some problems cannot be fixed with laser surgery. Once in a while, we get patients that have severe degenerative disc disease that it's beyond laser. Like the only thing I can do is fusion. It's rare. It's honestly very rare that that happens, but it does happen. All right, I've been pulling my tube back, and we're near, I'd say 5 minutes to go, Dr. B. We're near the back of this disc at this point where, remember how painful it was for her when I was trying to put it in? So, there's still a piece of herniation right there. Very thick. Very thick. I'm going to try to grab it out. I was just talking to Henry. We're going to put together for the new website. Oh, yeah. Almost had it. A series of interviews with me where we're going to dive into who is Dr. Deuk Majan. What can we learn about him? And they'll be featured on our new website, the new Deuk Spine Institute website. We'll interview all of our doctors,
Correct.
and not sure we want to know what Dr. Davis is all about. He got me worried sometime.
Never ask those things.
Right? Don't ask, don't tell. You're too funny. Oh, geez, look at that. Talk about a bundle of inflammation, huh?
That'll make her happy.
Right? That's it, right there. Look at all that blood vessels there. Chronic inflammation, L5-S1. This is why we're here, folks. This is the worst part right here. Once we zap it with a laser, the back pain goes away. Just that little piece of herniation, it just keeps floating around in my face, making it too hard for me to see. We're going to be done in about 2 minutes. But you see what I mean? Any other questions from the audience?
No current questions, but we do have a comment from Augie once more on YouTube saying it was a herniated disc and now pain is shifted a little bit to the side post-surgery. It's still in the L5-S1 area.
Sure. It's probably either your disc or your facet, yeah. Or both. Could be both. So we'll figure it out. All right, I need to grab that. Again, another piece just sitting in front of me. I think we're just about done. And because the disc is so collapsed, there's a nerve right there. You guys see it? At 9 o'clock,
Yes, we
the
do.
bottom edge of the nerve. I'll show you a better view in a minute. First, I've got to finish the surgery, and then I'll show it to you. Just a little bit of blood obscuring the view. Any other questions?
At this moment, no current questions.
Your lens just is flat on the end, it just looks straight down, right?
No, the lens is angled at 20 degrees.
20 degrees?
Yeah. All right, that's it. Take this. Let me show you guys the nerve, if I can. Let me have the grabber first. That'll help stem the bleeding. All right, there. So there, the nerve is going to be right there. You guys see that? That's the bottom of the L5 nerve root. We're just underneath it. That's where the herniation is. You see how close it is to the nerve root? It's literally right there.
Yes, we do.
2 millimeters? Millimeter?
That's about the opening of the tube is 5.5 millimeters. Let's say 5 millimeters, because it does have an oval shape. I'm going to zap it one more time with the laser. Just to make sure. All right. The point is, the nerve is always just outside the tube. All right. That's all she wrote. There's no more questions. You can end the live stream. And you guys got to see the nerve root today. That was the nerve root. The L5 nerve root. See how close we are. Very close. Something maybe, this is bent. I think that's bent. That's bent. Oh yeah, it's bent because I was bending it to get in. I mean, not bending it, I was putting a lot of pressure.
Can you not flex the hips?
See it?
Yeah. Can you not flex the
This
hips?
looks like Peyronie's disease.
Or rotate the pelvis to give you any more space?
I think I just bent it back. You might be able to.
I mean, it's not that uncommon for you to have a problem with
I bent it back almost all the way.
the
Iliac crest? Yeah, it's the hardest level to do. I'm like the only surgeon in the world that actually does it. Transforaminal. Everyone else says they go translaminar, they're like, it's too hard. But translaminar means you're removing the lamina and the facet and the ligament, so you're doing everything that I don't want to do, which is destabilizing the spine, creating bleeding, scar tissue, muscle trauma. Can you see this, Henry?
Yes, we can.
All done. She did great. That one little spot, that one little area of inflammation, that was it. Now it's gone. Do we have a stapler? Okay, huh? Scopius is going to be a 5 because of the difficulty and the pressure. Thank you. All right, everybody, have a wonderful afternoon. We're done. Great job, Luis. Great job, team. You guys are the best. Dr. Davis, thank you for your help. Dr. Berndes, Jordan, the little mouse in the corner and the cockroach on the ceiling. Thank you all. You can end the broadcast. We'll be back on next week, Tuesday, right?
Copy that.